Hello, so this is MN664 Unit 8 Journal. So, a patient that I've seen this week, a never seen before diagnosis. Well, at this point, it is week 8, and I completed the family nurse practitioner program and had the pleasure of precepting with a um, provider who seen medicine patients and also psychiatric patients. So I spent 2 rotations with him for a total of 20 weeks. And so far in this program, the psychiatric mental health nurse program, I've seen I've spent 10 weeks, 20 weeks. So that's a total of 40 weeks so far. So it's really not a diagnosis that I have not seen before, or should I say, I have not seen any new diagnosis. But what I do want to talk about this week is how patients can present. So we had a patient who came in this week, and he was a handsome guy, you know, dressed neat, talk normal, and I was just looking at him, and we were talking about his treatment plan or whatnot. And so he was schizoaffective, and I think I gotta put it up here. Schizoaffective, and this is probably gonna be over 5 minutes again. Let me see. Is this him? Yeah, I think this him. Bipolar, ADHD. Yep, this is him. So, 20-year-old presents to the office with his case manager. He has bipolar 1, current or most recent episode manic with psychotic features, ADHD combined, and he is taking Klonopin 50 milligrams 3 times a day. He is taking olanzapine and samidorphan. He's also taking Strattera. So, you know, we were just talking about his treatment plan and how things were going since his last visit. And he, just like I said, looked at so normal. So I read his chart to see, you know, what psychotic behaviors he had or what was going on in his past. And so I read that to make it quick, he was in a hospital, behavioral health hospital, and he met some guys who did music, and he met them at a studio in Detroit, and the cops were called because he was outside yelling, taking off his clothes, being inappropriate, making sexual gestures to people, and just looking at him, you wouldn't even think like he would do something like that. Of course, he was responding to internal stimuli, and what I've learned from that is you can't judge a book by its cover. You know, a lot of the people that I've seen, they have jobs out in the communities, but they have these disorders. So a lot of times, you know, you have to, it just kind of made me, I'm not disrespectful in any means necessary, but um, I am guilty of judging people or whatnot in the past or whatnot, and not knowing their situation, why they may be acting the way they act or whatnot. And this just kind of opened my eyes to, you never know what someone is going through mentally, you know, and so I have to reflect also. When I reflect, I have to understand that, you know, sitting in that room, I was kind of looking at him like, no way, like he's psychotic, like what? He just doesn't look like it. So when I reflect, what I have to do better is basically, it's not counter-transference, but basically just, if they're coming there, they have some type of mental illness or whatnot, and I have to not try to judge a book by its cover. That's basically what I'm trying to say. And so I gained knowledge in that sense, as far as being more professional, not judging a person by their looks, but not also not judging them on their past experience either. But, you know, talking to them, seeing them in a healthier state, reading their past medical history, psychiatric history, is to basically you get a better picture and understanding of that individual. And so that's the impact it had on me in increasing my understanding, as far as my role. Just keep it, the provider-patient relationship, professional, and again, my personal strengths are, I will continue to learn, read, and educate myself about things that, you know, I am not familiar with, or things that I have to improve. And let's see. And that's that. And in my future practice, that's what I would be. I would not, like I said, I would look at the patient and the patient history to better understand the patient and build a good rapport or therapeutic relationship. Sorry the video is so long, but I'm known for making long videos. Thank you.